Well, if you are a sufferer of chronic back pain, then you've tuned into the Morning Blend on the right day. Our next guests have a system that can help your pain issues, improve your posture, and align your spine.
Dr. Evelyn Haworth and Kelly Haworth are here to show us how the Tru-Align body system works. Guys, thank you so much for coming.
Thanks for having us.
So let's start out. What are some of the most common ailments that people come into your office with?
Neck pain and lower back pain, sometimes upper back pain, headaches would be the most. Sciatic, pinched nerves, pain going down the arm, numbness in the hand, pain down the leg.
So head to toe.
Yeah. What are some of the causes of that?
Usually it's from being misaligned. There's pressure on the nervous system exiting out of the spine. Sometimes it's brought on by trauma. Sometimes it's from bad habits like poor posture.
We sit too much. We do too much in front of us. Everything's forward nowadays.
We're hunched over.
Yep.
So you two have invented this really, really cool thing we have right in front of us, the Tru-Align. So tell us about this and who it's for.
This would be for, like what a chiropractic patient would go to a chiropractor for. It helps to realign your spine. In other words, put the vertebrae back in position. Also, it helps to restore better posture and flexibility. Unfortunately, in our modern society, like he was saying, everything is forward. So unfortunately, we get kind of frozen that way because we're highly elastic beings. What this does is help restore not only elasticity, but help restore the normal curves. We're supposed to curve forward on the neck and forward on the lower back, and most of us curve out too much in the upper back. And that ends up putting pressure on the nervous system, and when there's pressure on the nervous system, the muscles tense up. So it's a whole scenario, and it's never just one area. Even if you only feel like you suffer with neck pain, there's going to be something compensating elsewhere in your spine.
So who would you say, who would you say should use this? And can they use it alone, or do they need someone to sort of give them pressure on their back at the same time?
It works beautifully simply by using gravity. Gravity is all that's needed. Now, if you're lucky enough to have somebody that can massage you a little while you're on it, a 5-minute massage is amazing on this. Many massage therapists have noticed that, as well as acupuncturists. That having somebody on this system, because it makes sense. If you took a rubber band from here to here and now you press down on it, it not only straightens, but it also gets longer and more flexible. So this helps to restore the normal elasticity, the better position, takes pressure off the nerves, allows the muscles to relax, and then, wow, by accident, it does the jaw. Out of vanity, I cut this out on the face piece, can't have wrinkles. It used to make, the first 6 face pieces made wrinkles. I didn't want that. People will do for vanity what they won't do for health sometimes.
Too much.
So for that reason, we cut that out. It ends up, it does a little facelift, but it aligns the jaw.
You know what? It sounds amazing, and you brought it all this way. I think I want to try it out.
I'd love that.
I want to stretch out my back a little bit and make it feel a little better, so I'm going to get on.
Yeah,
Oh, I'm honored.
Yeah.
Thank you.
And I'm sure our viewers are dying to see just how it works, too. And I want to ask you, while he's getting down there, why is it so important for him to be facing down instead of maybe lying on his back?
Well, actually, I just want to make sure he's centered. You want to go a little to the left. There you go, honey. We don't want you to be on it, so that's, you could have checked that yourself as well. This is perfect.
When you lay face down, the muscles are not engaging. So they're more flexible. They're able to take the stretching and going into the positions that we want them to. If you lie on it, face up, it engages the muscles, and then the muscles resist what we're trying to change.
And there's pressure both on the vascular system and on the muscles. So they tend not to relax as well. This way, there are devices that you lie on that are intending to do the same thing. Number one, they only do one section at a time. This does everything at once. And maybe that's one of the reasons the body responds so well, because it is a chain of events, and it's treating that entire chain.
So, Alex, you look pretty comfortable down there. How you doing?
Oh, this is fantastic. I have to say, my lower back is getting a nice stretch, and I definitely feel it in my neck, too. And of course, as the doctor was saying, my face is definitely getting that relief. I have a lot of allergies, and the sinus pain, it comes with the allergies, and this is actually doing a lot to relieve that. Now, Evelyn, you said can pregnant women use something like this?
Oh, absolutely. The very first I experimented on my loved ones.
She can hear us.
Yeah, on the family and friends. Then the first actual patient was a pregnant lady. I wanted to take advantage of the situation that she was 7 months pregnant.
That's a condition that's going to cure itself
fairly
quickly, so you've got
and I don't
some
accept
time.
new patients, so who knows knows when I'd have a chance again. It was amazing for pregnancy.
Really?
In fact, this was her second child. It went fast.
Yeah.
And she didn't have any back labor. That makes sense. Back labor comes because you've got this big weight here that pulls everything forward and together. So this helps align your spine, keep it stretched open, so when you do have the baby, it doesn't give that additional pressure on the back.
Wow. Okay, well, what about somebody who's already had some sort of spinal surgery? Could they use this?
Oh, it's wonderful for scar tissue. We've had several, unfortunately, especially if you've had surgery, there's going to be scar tissue in that area. And then above and below, that's less flexible than it should be. So above and below, guess what? They go wrong because they're overdoing it. Right. So we've noticed wonderful results. I have some patients that have had surgeries. And usually you see if they have a fusion, especially in the lumbar, the next one to go is going to be the one above it. That hasn't happened.
Well, I feel like $1 million, I have to say.
Well, you look great. You look taller already. Well, I want to thank you both so much for joining us this morning. What a great invention. We're going to make sure our viewers have all of the information.
Thank you so much for having us.
And for a special offer for viewers, you can take advantage of their lowest price offer of $350 by using the discount code THEBLEND, all in one word. For more information, you can call 1-855-Kacelia or 1-855-522-3542 and log on to Kacelia.com.